Hello, everyone. My name is Nate Durfee. Today, we're going to be looking at the topic of universal healthcare in the United States. So, my thesis for this is that the United States should not adopt a European model of universal healthcare for its citizens. Some background information. So, what is universal healthcare? A quote from Masterclass in 2019 that referenced universal healthcare as any action that the government takes to provide healthcare to as many people as possible. Rook, in 2018, Rook also looks at universal healthcare as everyone having equal access to quality healthcare that improves the health of the patient, and that seeking such care would not cause financial harm to those receiving the healthcare. There's a few different types of universal healthcare. The first type is a single-payer system. Here, governments provide free healthcare paid for with revenue from income taxes, and all services are government-owned and providers are government employees. Second type is a social health insurance, where insurance is through employers, through payroll taxes. The taxes go into a government-run health insurance fund for everyone, and here you have private doctors and hospitals, but governments have the ability to control the prices as well as controlling the health insurance price. The third type is a national health insurance. This is public health insurance that pays for private practices, and you have every citizen paying into a national insurance plan here. So what does the European model of universal healthcare look like? So the European model has both single payer and social insurance, as well as it has privatized options. The private insurance companies here, though, have certain government regulations. Within the European model, each country kind of dictates their own method of universal healthcare. So in places like France, you have social insurance. In Germany, you have social and private. So in Germany, it looks like that you have a requirement of public health insurance, but if you make over a certain amount of money a year, then you qualify for private insurance and can choose to pay for private insurance, or you can just keep the public insurance. In Switzerland, you have a social/private method to it, where you have coverage provided by private insurers, but residents only pay up to 8% of their income for the insurance. And if they pay any more than that, the government reimburses them for the high costs. In the UK, you have a single-payer system. Thales, in 2021, stated that during the second half of the 20th century, all European countries progressively extended universal healthcare to cover all of its citizens. So it wasn't until recently that Europe started to fully move into a universal healthcare model. In the US, you have a different kind of healthcare model. So you have a majority of private insurance in the United States. As well, you do have Medicare and Medicaid. These two healthcare ideas were amendments to the Social Security program in 1965 by Lyndon B. Johnson. In Medicare, you have coverage for people 65 and older, as well as those qualifying conditions or disabilities under the age of 20 or 65. That's federally funded. Medicare covers coverage for low-income families. That's funded by actually both state and federal governments. As well as recently, in reference to healthcare in the U.S., you had the Affordable Care Act, or Obamacare, which was passed in 2010. Masterclass states that it's medical care primarily financed by private insurers, while the government provides a subsidy to all citizens to participate in the private insurance. So it's kind of a way of promoting people to have health insurance. As well as the ACA prohibits private insurers from denying coverage or charging higher insurance premiums for clients with pre-existing conditions. So again, a way of promoting health insurance for citizens in the U.S. So my first reason why I'm against the U.S. adopting a European model of universal healthcare is that it's difficult with government implementation, and also there's a loss of innovation within healthcare. These are both going to be from an economic perspective. So looking at government implementation, Masterclass stated that universal health care is expensive. If government is struggling with its budget, it may find that healthcare is taking money away from other essential programs. Looking at the U.S., there's always a debate about the federal budget and federal spending. Adding universal healthcare to it just increases that difficulty with figuring out a budget. As well as for universal healthcare to be there, you have to find money to fund the program. That leads to increased taxes on people, and citizens in the U.S. truly do not like being taxed. Zeif et al. In 2020 stated that one proposal for universal health care recently pushed included options such as a 7.5% payroll tax plus a 4% income tax on all Americans, with higher income citizens subject to higher taxes. But he also went on to state that they weren't positive if that would truly cover all of universal health care expenses. So again, taxes and taxes on the U.S. people, which some people might not agree with, as well as implementing a European model poses a problem with deciding who taxes. So if the U.S. were to implement a European model, it means that the states are choosing what type of universal health care is right for its own citizens instead of a federal way of doing it. So then you look at, who taxes? Does the federal government tax or the state's government tax? Or are you getting taxed by both? Again, it's trying to figure out where the money for the universal health care is coming is difficult to dictate with the European model. Another idea through an economic perspective is with universal health care, you're losing innovation. With universal healthcare, economic competition and freedom of choice would hinder innovation within the medical field. So you wouldn't have as much competition or choice with universal healthcare due to government regulations and governments choosing how they're run. An article by Scrubs in 2019 stated without competition, facilities, institutions, and companies would have less incentive to improve the quality of care and explore new treatment options. I know you could argue that with universal healthcare, the government's setting a certain quality of care, but with that quality of care set, you're not required to improve on it. You're set at that expectation. There's no push and no way of improving it or innovating and finding new methods to provide that care or better qualities of care for the patients. My second reason is that with universal healthcare, there's a difficulty in accessing services for non-emergent care. So elective surgeries are just procedures you need to go get looked at. There's increased weight due to a focus on emergency health. Things need to be done now instead of possible areas of issues. Looking at the chart on the right, you can see that comparatively speaking, those 4 European countries have a higher percentage of waiting 4 weeks compared to the U.S. With private insurance companies. You have a 5% compared in the U.S. compared to the lowest is a 11.9% or a 30% or a 20% or even a 50% chance of waiting 4+ weeks in a country like France with a universal healthcare model. So if you want to be seen, it's tough. If you want to be seen for just a checkup or stuff like that, it's tough to truly find a way to get in the doctor's office. As well as government cost cutting can lead to a reduced availability of care. I'm thinking such like rural communities. If governments are cutting costs, they're going to cut costs in rural communities that don't see as much traffic as those bigger cities. So then you're missing out on care for certain areas within the country. As well as Zeif et al. In 2020 brought up the idea that the average wait time for elective hospital-based care in the UK is 46 days, with some patients waiting over a year. So with universal healthcare, you wait longer to be seen for, yes, elective stuff, non-emergent stuff, but if you want to be seen, you have to wait and plan out your months instead of being able to just walk into a clinic and be able to be seen that same day in a country like the US. My third reason is that a European model of universal healthcare would be difficult to translate to the United States from a strictly political standpoint. It presents a tough avenue for adaptation through the states and through the federal government. Where in Europe, you have each country has its own system. It would mean if you adapted it here, it would mean each state would have its own universal healthcare system, as well as it forces states to control most aspects of universal healthcare, which can put a strain on the states. Instead of allowing the federal government to have a big say in it, you focus on the states. And I understand that depending on what your views on government are, some people do like the states having more control than the federal government and whatnot. Thales in 2020 stated that there's no single European healthcare system as such. Social protection does not fall under the jurisdiction of the EU. So if that was translated to US, there'd be no social protection by the federal government. So it'd all be controlled by the states, which would be tough. And then again, it's how do you charge for, or you look at who should be in charge of controlling universal healthcare within the states. In my opinion, the federal government should have a decent say in how it's controlled. If you're going to have universal healthcare throughout the entire country, it needs to be united in a certain way and not just different ways in different areas. Some counter arguments to why the U.S. shouldn't adopt a European healthcare system or a universal healthcare system is that universal healthcare system lowers overall cost. It lowers copays when needed, as well as it lowered healthcare costs due to government control. It means that there's also doctors are able to reduce administrative costs and hire less, effectively charging patients less. You look at the chart on the right, you see that the U.S. is at 80% healthcare gross domestic product, as well as almost a $10,000 cost per capita. The next closest is Switzerland with a 12.4% GDP and almost an $8,000 per capita. Yes, healthcare cost is higher in the U.S., but looking at this argument, you see that doctors would be able to reduce administrative costs and hire less, which you're losing jobs there, but as well as you're not being able to be seen as fast. So if I want to be seen for, say, my arm's aching or any other issues I might be having that aren't truly emergent, I have to wait months and months. I do agree that universal healthcare does lower costs, and that is a benefit. But looking at the European model as a whole, it is not something that the U.S. should adopt at all. The second counter argument is that for universal healthcare, especially with the European view, is that there's a regulated standard of service. Looking at it from a societal perspective, you're getting mandated standard of care for everyone, regardless of anything. Thales 2021 stated that socialized healthcare systems are built on the principle of solidarity. No one is left behind. Everyone can access medical service and has a health insurance. Yes, to go against this, yes, everyone has access to medical service, but it's not as tailored to that individual. It's not as focused on everyone. It's, yes, treating everybody, but you're not looking at as great of plans. I do want to say that the U.S. should look at some sort of healthcare system. The European model is a great way of getting an idea of what to look for, but it's not truly the model that the United States should implement if they're going to incorporate a universal healthcare model. Here are my references. Thank you.